twisting motion, contraction. So what might be the direct blows? Okay, the causes of the fracture, why there is discontinuity in the bond. So give me one example of direct blows. What may it be? Okay, the causes, what may it be? Direct blows. Direct blows may be,
Ma'am, some stress due to road accidents and
yes,
all.
maybe some kind of injury, some kind of um injury, okay, hitting the bone, directly hitting the bone. All right. And then what about crushing forces? Crushing force, it may be because of any accident, it may be because of any fall. Okay. And what about sudden twisting moment? Okay, sudden twisting motion. Okay. And then extreme muscle contraction. So these are the causes of fracture. Okay, not only this, if you have any pathology condition, if you have any osteoporosis, osteomyelitis, if you have any Paget's disease, if you have tumor metastasis, then you are at the risk of getting this fracture. So these are the causes of fracture. Okay, direct blows, it may be your like injuries, any fall, any accident, even crossing force also accident, direct blows. Okay, injury, and then maybe fall, road traffic accident. Okay, crossing forces, even your sudden twisting motion. Okay, those who played this tennis and all this using repetitive motions. Okay, and an extreme muscle contraction. Okay, these are the causes of fracture. So now coming to the types of fracture, okay, all of you are being aware of this, the types of fracture. Now you tell me what is a complete fractures and what is an incomplete fracture. Is anybody, these are being done, okay, by you. So now you tell me what is complete fractures and what is an incomplete fracture. Complete fracture, there is a break across the entire cross section of the bone. Okay, across the entire cross section of the bone there is a breakage, then we term it as a complete fracture. Okay, an incomplete fracture, that breaks occurs only through the part of the cross section. Okay, when there is a complete the name itself, the entire cross section of the bone is being broken. But if in case of incomplete fracture, there is only breakage in some part of the cross section of the bone. Okay, only on some part of the cross section of the bone. Now uh, in your closed fracture is sometimes known as a simple fracture. Okay, it's one that does not cause a break in the skin. All right, closed fracture, when you say closed fracture, it's a kind of fracture where it is also known as a simple fracture. It does not cause a break in the skin, even though you have a fracture, but the part of the bone, it won't come out of the skin. That is known as a closed fracture. What is an open fractures? An open fractures is the one in which skin or the mucous membrane wound extend to the fracture bone. All right, even the bone started coming out, it showing up to your skin and your mucous membrane. All right. So what is complete and incomplete? In complete fractures, there is complete breakage in the entire cross section of your bone. In incomplete, there is only some part of the cross section of the bone is breakage. Closed fracture, the one which does not cause a breaks in the skin. Okay, open fractures, the skin is a kind of the fracture in which the skin or the mucous membrane wounds it extend till the to the fractured bone. Open fractures are graded, okay, according to the following criteria. Grade 1 is a clean wound less than 1 centimeter long. Grade 2, when the wound is larger without any extensive soft tissue damage. And grade 3, when there is highly contaminated and infectious, has gone over to the extensive soft tissue damage and is more severe. All right. Till now, we have studied about incomplete fracture, complete fracture, closed fractures, and open fracture. Now, coming to the classification of the fractures according to the anatomical placement. All right. Now you will see the pictures: green stick, spiral, comminuted, transverse, compound, and compression fracture. These are all the types of the fracture according to the anatomical placement. Okay. Now coming to the green stick fracture. Green stick fracture, it is a fracture in which one side of the bone is broken while the other is bent, like a green stick. All right. It is a type of the fracture in which, okay, there will be two bone. In this, one part of the bone is broken and the other one is bent. All right, did you understand? Only the one side of the bone is broken and the other side or other side of the bone is only bending. All right, so this type of fracture is known as the green stick fracture. Okay, it used to come in this central exam. Okay, so what is green stick fracture? Your answer is one side of the bone is broken while the other side is being bent like a green stick. So this is green stick fracture. Did you understand? Now coming to the spiral fracture. Okay, a spiral fracture is a fracture. They are also known as a torsion fracture sometimes, in which the bone has been twisted apart. All right, the name itself spiral. Okay, in the name there is breakage of the bone in the spiral structure. Okay, in a twisted apart, the bone is being twisted apart. All right, so this is known as a spiral. Now coming to the comminuted fracture. A fracture in which bone is broken, splintered, or crushed into a number of pieces. Okay, if you have any crushing injury, okay, suppose if a rolly or if a truck roll over your bone, okay, roll over or bone, then you will have this comminuted type of the fracture where you will have multiple number of bone being crushed, okay, into a number of pieces. That is known as the comminuted fractures. Now coming to the transverse fracture by the name itself. Okay, this is a kind of the fracture in which there is bone breakage across the bone at the right angle to the long axis of the bone. All right, the long axis of the bone, and then the breakage will be at the right angle. All right, you can see in the X-ray also. Okay, the transverse, the breakage is in the form of the transverse. It is a little bit similar with the spiral, but in spiral it used to be through the midsection. All right, but in this transverse it is just right angle to the long axis of the bone. All right, the fracture is at the right angle to the long axis of the bone. This is transverse fracture. All right, this is little similar with the spiral fracture. Now see the spiral fracture, the bone has been twisted apart. Okay, the bone has been twisted apart. Now your bones are becoming like two pieces just because of the spiral fracture. The other part, one long bone, it become two part. Okay, it's been twisted apart in case of the spiral fracture. All right, in case of this transverse, okay, there is breakage across the bone at the right angle to the long axis of the bone. All right, spiral fracture and transverse fractures are little similar. Okay, so now coming to the compound fractures, a fracture in which the bone is taking through the skin. All right, the bone is taking through the skin. It is also known as the open fracture, like we have studied in the first two slides. Okay, compound fracture. So open fracture is also known as the compound fracture. All right, now coming to the compression fracture, it happens mostly in your spine. What will happen in this? The spine will be compressed. Okay, it is a kind of the fracture which is caused by compression. Okay, the act of pressing together. Compression fractures of the vertebra are especially common with osteoporosis. Any people with the risks with the history of osteoporosis, they have a high chance of having these compression fractures. In this, the bone will be pressing together. The spinal or the spine bone, the vertebra will be compressed, will be pressed together. Okay, so this is a kind of fracture in which the bones are act together, compressed together. Especially you will see the case in case of the osteoporosis. All right. So now we have till now what have the types of the fracture. Now you tell me what are the types of the fracture. The first types of fractures are, tell me the types of fractures.
Incomplete fracture, complete fracture.
Okay, now you tell me what
open
is
fracture, closed fracture.
Green stick fracture, spiral, comminuted.
What is comminuted fracture?
There are lots of injuries in multiple bones.
Yes, there are multiple, the bone is being broken into number of pieces. Okay, what about this compression fracture, where you will see most of the case you will see in vertebrae? What is open fracture?
The bone will come out, like skin will be break.
Will come out. Yes, very good. And what about closed fracture?
And there is no, like skin integrity will be like before, no skin breakage will be there.
What about incomplete fracture? What is complete fractures and incomplete fractures?
Only 1% of the bone will be break in case of incomplete fracture.
Yes. What about green stick fracture?
one side will be break, then another side of the bone will be bent down.
Okay, very good. Okay, very good. Now coming to the other types of the fracture, okay, avulsion and depress. Avulsion fractures which occurs when a fragment of the bone tears away from the main mass of the bone, okay. When a fragment of your bone, when you have multiple fractures, a piece of that bone tears away from the bone mass, that is known as the avulsion fracture, all right. So coming to the depressed fractures, a fracture in which fragments are driven inward, okay. The fractures are driven inward, seen most frequently in fractures of skull and facial bone, all right. Avulsion is when the pieces are being torn away from the main mass of the bone. But in case of a depression, by the name itself, the bone pieces or the fragment are driven inward. Especially you will see this in the fracture of skull and facial bone, okay. So this is another type, avulsion fractures and depression fractures. Now coming to the pathologic fractures, okay. It occurs through an area of diseased bone, okay. What may be the diseased bone? It may be of osteoporosis, it may be of cyst, or it may be of bony metastasis, or if you have any tumor, okay. So because of this pathologic condition, the person will undergo this fracture. So we term it as pathologic fracture, okay. And then stress fractures are fracture that result from repeated loading, okay, without bone and muscle recovery, okay. If you use the bone continuously, then there is high chance, because of that so much of stress, repeated motion, okay, repeated motion, there is high chance of getting that fracture. So we termed it as stress fracture, all right. So these are the other type, the avulsion fracture, depressed fractures, pathologic fractures, and stress fracture. Now coming to the pathophysiology. Due to any etiology, okay, it may be of any crushing movement, or it may be of any direct blows, it may be of excessive muscle contraction, okay, the fractures occur, or it may be of because of any pathology, pathological condition like your osteoporosis, like osteomyelitis, or it may be of any tumor or bony metastasis, or it may be because of your any stress, okay, any stress. So because of all this etiology, fractures occurs. The muscle that were attached to the bone are destructed, of course, that is true. Your bones are being surrounded with your tendons, with your ligaments, with your muscles, they're all this. So if you have fractures, your muscle, they are attached to the bone, they are disrupted, and they causes spasms, okay. The proximal portion of the bone remains in place, okay. The proximal, okay, the proximal portion of the bone remains in place, while the distal portion, they become displaced. So in response to that, where there is spasm in the associated muscle, all right. The proximal, okay, the proximal is the close, or the close part, okay. The close part of the bones remains in place, while the distal is the away part, distal is away, okay. The away part become displaced in response, okay. So because of that, there is spasm in the associated muscles, all right. In addition to in addition to this, the periosteums and the blood vessels in the cortex and the marrows are disrupted, okay. So because of this, soft tissue damages that occurs, so it leads to bleeding and formation of hematoma, and then beneath the fractures or beneath the periosteum, okay. So because of this, the bony tissue surrounding of the fracture site, they start dying, and they create intense inflammatory responses, okay. Once this inflammatory response is started, it will release many chemical mediators like your histamine, your prostaglandins, your interleukins, okay. Because of all this thing, it results in massive vasodilatation, okay. When you have this vasodilatation, there will be edema, pain, loss of function, leukocytes, and infiltration of WBC. This is the pathophysiology of fractures, all right. Did you understand? So
Yes, ma'am.
now let's repeat again, okay? Because of any etiology, it may be a direct blows, it may be of crushing injury, it may be of any stress, or it may be of any pathology condition, okay? Fractures occurs. When there is fractures, the proximal portion, they remain attached, but the distal portion, they become displaced. So because of this, the muscle started spasm. So once the muscle started spasm, all these blood vessels and then periosteum and then even your marrows are being disrupted. Because of this, the inflammatory responses has started. Once this inflammatory response started, it started producing your cytokines, your histamine, your prostaglandin. Because of this, it results in vasodilation. So what will happen when there is vasodilation? Of course, obviously there will be edema. Because of edema, you will have pain, okay, loss of function, even you will have infiltration of WBC. So this is how the pathophysiology of fractures happens. All right. So now coming to the clinical manifestation, okay, pain, because there is breakage of the bone, discontinuity of the bone, there is swelling, okay, there is muscle spasm, you will definitely have pain and loss of function. All right, deformity and shortening and crepitus. Now you have been telling from your case presentation crepitus and crepitus. So what is the crepitus? What is the meaning of crepitus? Now you tell me, any one of you who have done the presentation on fracture, now you explain me what is crepitation just in simple terms.
This is the friction sound between the bones, between the two bone or
Yes,
joints.
yes. So what is the relationship between this crepitus and your fracture? So when you have this discontinuity, when you have this breakage, when you have all this thing in your bone, so when you try to move, when you try to make a movement in that, they will make a sound of, isn't it? So in a flat paper, just take a flat paper, okay, just a good paper. When you try to squeeze the paper, it used to make sound. Am I right? So like the same way, the bone, it has to be like straight. But when there is some fractures or some pieces, some broken bone there, when you try to move, like when you try to make a movement, maybe either active or passive, they will make a sound because there is this continuity in the bone. All right. So that is why the patient will have this crepitus. They will make this like friction sound. Did you understand? And then swelling, because there is massive vasodilation.
Yes, ma'am.
So the patient will have swelling and then discoloration because of this hematoma formation. All right. So now coming to the diagnosis of fractures. Okay. So history collection. What kind of history are you going to collect? Now you tell me what kind of history are going to take. The patient who comes with a history of like, I might have this bone fractures, I have this pain, swelling. So he came to the hospital. So what kind of history are you going to ask from the patient?
Any kind of stress or any kind of like injury,
Yes,
accident did it happen?
yes, very good. Or is it a fall, or is it because of road traffic accident, or does he have any contusion, or is he a sportsman, okay, or is he daily like heavy exerciser, because they use this repeated motions. All right. And then is if the guy is like, if the person is more than above 50 years, because they have a high risk of getting osteoporosis. All right. So we have to ask this kind of history. Okay, are they taking on steroids? Because taking steroid drug for the long time, they are putting the patient at the risk of osteoporosis. The bone density becomes so low, okay, if you keep on taking the steroids or steroids drug. All right. So these are the history that we have to ask. Okay, any previous history of infection or no? Any previous history of fracture? Okay, any previous history of osteomyelitis or any Paget's disease? Any on hormonal therapy? All right. So these are the history that you are going to go through. Now coming to the physical examination, what kind of physical examination are you going to do when a patient comes with a fractures? So now you will do all these lab tests and all these things. These are secondary. The first thing you will see, you will do this some passive range of motion. All right. So you will see, you will hear this
Yes.
sound also. And then you are going to see like whether the types of the fracture, is it like, is it coming out of, is it a closed fracture, is it a simple, or it is a open fractures, is it a, so we are going to do all this physical examination. All right. The patient will have pain, there will be swelling, there will be hematoma, you will see deformity there. All right. Now you will the doctor will order for x-ray. From this x-ray is again to make sure whether what kind of fractures they are going on. Okay, is it either comminuted fracture, is it either green stick fracture, is it either a compressed fractures, is it either complete, or is it either closed? Okay, is it either avulsant or is it either depressed? So to rule out, the doctor's advice for x-ray what kind, to rule out what kind of fractures is this. All right, CT and MRI, the same goes for it. All right. So now coming to the management, how are you going to manage? Now let's see the first aid treatment. Okay, the first aid treatment, it will be reduction. As you all have seen in your posting, in ortho posting, you have seen open reduction, closed reduction, you have seen CAS also. All right, so let's see reduction. Okay, reduction of a fractures, that is reduction in the meaning setting your bond. Okay, it refers to the restorations of the fracture fragment to the anatomic alignment and rotation. All right, they are going to restore the fracture fragment according to your anatomic alignment. Okay, this is known as a reduction. In reduction we have open reduction. Okay, so open reduction, it is a surgical approach. Okay, the fracture fragment are reduced. Okay, they will align, they will restore the fracture fragment according to the anatomic alignment through the surgical approach. External or internal fixation devices like metallic pins, wires, screws, plates, nails, or rods, they are going to use to hold the bone fragment in position until the solid bone healing occurs. All right, this is a surgical approach in which the fractures are going to be fixed, okay, internally or externally by pins, by screw, by wires, by plates, by nails, or by rods. Okay, just to hold this fracture fragment all together in an anatomic alignment. It can be either internal or it can be either external. All right. So when we say internal fixation, we used to, now the brachius bone, we will open it, okay, in that brachius bone, and then we are going to use some metallic pins or screw, okay, just to hold the fractured fragment all together. When we say about internal fixation, okay, you can see this is a leg fractures reduction. They're doing this reduction surgery with intramedullary nailing. All right, titanium nail, they are going to insert some nails, okay, and then nail counters sunk. All right, so this is the internal fixation. So we are going to open the muscle, go through the bone, the fractured bone, okay, put some nails, screw, okay, rods to fix the fractured bone in an anatomical alignment. And coming to the external fixation, okay, when we say about external fixation, screw are placed into the bone above, okay, into the bone above and below the fractured, and a device attached to the screw from the outside where it may be adjusted to realign the bone. I think most of you have seen this. All right, did you remember most of the ortho patient in ortho ward, they have this external fixation? Okay, I have observed you guys are also helping doctors in doing dressing also. All right, so this is the external where screws are placed above the bone, okay, and then below the fractured. All right, and then the device is putting outside of the skin where it can be adjusted, okay, to realign. All right, so now let's see what is the difference between the internal fixation and external fixation. So when we talk about internal fixation, internally they are going to fix with some kind of iron rods, screw, or nails. All right, in case of the external fixation, okay, the whole thing, the rod, screws, they are going to be placed from the outside of the bone, okay, outside of the bone. All right, outside of the bone, they are going to use all these rods, metals, rods, iron nails, and screw. All right, internally we are going to fix inside the bone, but externally we are going to fix outside the bone. So this is a difference between internal fixation and external fixation. Now coming to the close reduction. All right, so the one we discussed is the open reduction. Okay, this is a surgical approach. Okay, the type of this open reduction is internal fixation and external fixation. Okay, internal fixation, we place it through the internal of the bone. Okay, we use nails, metallic nails, screws, rods. Okay, but in case of the open reduction, open reduction, external fixation, the rod, screws are to be used on the top above the bone. Okay, Now coming to the close reduction. Close reduction is accomplished by bringing the bond fragment into opposition, all right, placing the ends into contact, okay, through manipulation or through the manual traction, okay. When we say open reduction, it is a surgical procedure. When we talk about close reduction, it is done manually, okay. We are going to manipulate and we are going to do some manual traction. We don't need any surgery for this, all right. This is accomplished by bringing the bond fragment into opposition, okay, placing the ends of the bond into contact, all right. And then we have to do it through hands manipulation and a manual traction, okay. Extremity is held into the desired position while the physician apply a cast, a splint or other device, all right. X-ray are to be often to verify that the bone fragments are correctly aligned, okay. Traction, it may be, there are two types, okay. When we talk about traction, we have two types again, skin traction and skeletal traction. It may be used to affect fracture reduction and immobilization, all right. So now let's see what is immobilization, all right. So when we have a fracture, the first thing we advise is to immobilize the area, okay, whether it may be of open fracture, closed fracture, it may be of compressed, comminuted or green stick. The first thing is to be immobilized, because if you keep on moving, it will get worse. The breakage will be more. If there is a closed fractures, there is a high chance of turning it into an open fracture also, okay. So there is a high chance of breaking more also. So the first thing is to be immobilization, okay. So immobilization, we have to immobilize the part. It may be, we can do it by two types. It can be either do by externally or internal fixation, all right. The method of external fixation, it includes bandages, casts, splints, continuous traction and external fixator, okay. So immobilization types, it may be, we can do it either internal and external. So externally, what we can do these bandages, we can do this cast, we can do this splint, we can do this traction, and we can do this external fixators, okay. Metal implant used for internal fixation serve as the internal splint to immobilize the fracture. Now coming to the traction, okay. Traction is the use of weights, okay. It may be either ropes or pulley to apply force to the tissue surrounding a broken bone, okay. When we say about traction, we try to bring the end of the bone together in this side, okay. Skin traction, in you see the one we are using some weights or ropes or the pulley, all right. So the first one is we use some kind of weight here. Second pictures, we use some kind of pulleys, okay, to apply force to the surrounding tissue of a broken bone. It's skin traction to maintain the proper arm position, all right. To maintain the anatomic alignment, we use this traction, okay. So now coming to the skin traction, okay. I told you in the traction also we have two, okay, skin traction and skeletal traction. So traction comes under close reduction, all right. Close reduction meaning you don't need any surgery, okay. You have to do it, you have to manipulate it by your hands, all right. So the types of close reduction is traction. So types of traction is skin traction and skeletal traction, all right. So skin traction, so Berg's traction used for knee, hip bone fracture, all right. If you have any knee fracture, knee joint fracture or hip bone fracture, we use this skin traction, all right. So we are going to pull. Okay, coming to the skin traction, it is usually used for the knee joint fracture or the hip bone fracture, okay. So usually the weight we use for the skin traction are usually 5 to 7 pounds, all right. So in case of the skeletal traction, we need invasive procedure, okay. The weight is up to 10 kgs attached to the bone, all right. So now all of you, I want all of you to study the difference between skin traction and skeletal traction. So by tomorrow class, I'm going to ask all of you what is the difference between a skin traction and a skeletal traction, okay. So now let's discuss this splinting by tomorrow, okay. So to all of you, did you understand the types of fracture, the pathophysiology of fracture?
Yes,
Yes,
ma'am.
Okay, so tomorrow, so I want all of you to study the difference between skin traction and skeletal traction. Okay, at least few points. By the way, did you understand the difference between open reduction and closed reduction? Open reduction, it is a surgical procedure. All right, you require the two types of open reduction are your internal fixation and your external fixation. All right, in close reduction, you don't need any surgery. You have to do it, the fracture has to be manipulated by your hands. Okay, the types are your cast, your spleen, your bandages, all right, your traction. So in traction we have two types again, open skin traction and skeletal traction. So by tomorrow class, I want all of you to understand the difference between skin traction and skeletal traction. Okay, so from tomorrow we'll discuss about splinting again. All right, we'll continue with this all this splinting management, and we'll discuss about nursing management. All right, so now, till now, do you have any queries? Any queries you want to, or you want to add up any point?
No, ma'am.
Okay, then CR, please send me the attendance of those. Okay, and then send me a list of those absentees. Okay, then I will see you in tomorrow class. All right, take care, all of you.
Thank you, ma'am.